Have you ever wondered how doctors discover conditions that do not cause any pain or obvious signs? Imagine something important happening inside your body, something that could lead to serious problems down the road, but you feel absolutely fine. Doctors detect silent osteoporosis primarily through specialized bone density tests, especially the dual energy X-ray absorptiometry scan, commonly known as a DEXA scan. They also carefully evaluate your personal risk factors to determine when and if this screening is necessary. The reason osteoporosis is often called a silent disease is because bone loss happens without any noticeable symptoms. You will not feel your bones becoming weaker. The DEXA scan is key because it accurately measures your bone mineral density, giving doctors vital information about the strength and health of your bones. This measurement is then compared to the bone density of healthy young adults and people your age, using scores like the T-score and Z-score, which help predict your risk of future fractures. Several risk factors, such as increasing age, being female, a family history of osteoporosis, certain medical conditions like rheumatoid arthritis, or prolonged use of specific medications like steroids, can all prompt your doctor to recommend a DEXA scan, even if you are not experiencing any symptoms. So, how can you help in this process? The most important step is to have an open conversation with your healthcare provider about your personal risk factors. They can assess your overall health profile and determine if you meet the criteria for a bone density screening. If a DEXA scan is recommended, the preparation is usually quite simple. You might be asked to wear comfortable clothing without metal fasteners, and sometimes you might need to temporarily stop taking calcium supplements on the morning of your scan if instructed. One fascinating aspect of modern bone health assessment is that the DEXA scan itself is a quick and painless procedure, exposing you to very low levels of radiation, less than a typical chest X-ray. Beyond just the DEXA scan, doctors often use additional tools, like the Fracture Risk Assessment Tool, or FRAX. This tool combines your bone mineral density results with other clinical risk factors to estimate your 10-year probability of experiencing a major osteoporotic fracture. It adds another layer of precision to understanding your bone health. Understanding how doctors detect silent osteoporosis empowers you to take proactive steps for your bone health. By being aware of your risk factors and discussing them with your doctor, you can ensure timely screening. This early detection through tools like the DEXA scan and FRAX is crucial for identifying bone loss before a fracture occurs, allowing you to implement strategies that strengthen your bones and maintain a vibrant, active life.